Welcome to Medicare for All Explained. This podcast will enlighten our listeners and dispel the distortions that surround Medicare for All. Medicare for All Explained is produced in collaboration with Physicians for a National Health Program and is hosted and produced by Joe Sparks. I'm your host, Joe Sparks. This is episode 129. WISeR isn't. The complete sentence would be, WISeR isn't wise. WISeR is an acronym for Wasteful and Inappropriate Spending Reduction. It is generally spelled out with all capital letters except for the E. Please bear with me for about a minute while I mention a couple of other entities. The Centers for Medicaid and Medicare Services, CMS, is the parent organization of the Center for Medicare and Medicaid Innovation, or CMMI. CMMI is the department under CMS that created the WISeR model. Now back to WISeR. I do agree with part of the WISeR term. It will be wasteful and inappropriate. WISeR introduces prior authorizations into original Medicare. Prior authorizations are used by private insurance companies, including Medicare Advantage plans. Before doctors perform certain, usually expensive procedures, they need prior approval. The insurance companies argue that these procedures have questionable value, and this protects the patient from low-value procedures and saves money. They do save money for the insurance companies. Physicians for a National Health Program had this to say, quote, prior authorizations in private insurance cause widespread delays and denials of care, leading to increased administrative burden for patients and providers, end quote. Delayed care often means more health problems and possibly death. As one doctor, a gynecologic oncologist, said, it used to be that if we suspected cancer, we would want it diagnosed quickly, within a few days or at most a week. We would tell the patients that we want to start treatment within a week. Now we don't say that, and it can take 4 to 6 weeks before we can start treatment. And that delay can make a big difference in outcomes. That may be why all the doctors that I have talked to hate prior authorizations. Additionally, doctors and their staffs are not compensated for dealing with prior authorizations. There are other problems related to the WISeR implementation. The companies charged with administering WISeR are going to use AI to determine which procedures should be denied care. While public reporting on denial rates is limited, recent use of AI in claims processing has been correlated with drastically increased claim denials. Another major problem with the WISeR implementation is that the companies administering it are rewarded based on how much money they save. Patients' outcomes are not considered, and I find that infuriating. Let me repeat that. Patients' outcomes are not considered, and I find that infuriating. I think WISeR is an attempt to privatize original Medicare. And since we know how poorly private health insurance works, that is a really, really bad idea. So as we can see, WISeR isn't wise. It will increase delays in treatment that will cause worse health outcomes and more deaths. And the companies administering WISeR get paid based on how much money they save without any concern for patient outcomes. Sure, let's make our healthcare system even worse with the unWISeR model. So, as I said at the beginning, WISeR isn't wise. However, it is idiotic. Thank you for listening. You have been listening to Medicare for All Explained. Remember to tell your family, friends, and colleagues about this podcast. Information about Medicare for All Explained can be found at our website, medicareforallexplained.org. The music for this show is Super Bubbly by Jesse Spillane. The logo was created by Lily Sparks. Thank you for listening.